I'm Dr. Robert McDonald of the Telos Healing Center. My wife, the Reverend Dr. Lizette McDonald, and I created the Telos Healing Center some years ago in Southern California. I'm the founder of the Destination Method. I created it about 15 years ago, and I'm here to talk about the Destination Method and how it works in relationship to anxiety and depression. So I want to make sure that we understand what those terms might mean to many different people. Anxiety is oftentimes reported as a person feels very uncomfortable, worried about what might happen in the future. We think in the Destination Method that people create their anxiety by what they say to themselves in their mind's ear and what they see in their mind's eye. And so we address anxiety by changing their mind, changing the way that they think. We also address depression in the same way. A person who's depressed typically has certain kinds of internal thoughts that produce the depression. For example, they'll talk to themselves, call themselves names, talk about how bad they are, and they'll worry in a way that addresses their self-esteem and go into a low place. Recently, I was working with a woman who reported her own anxiety and depression, Judy, on a different DVD. Judy came to me during a public seminar, a free public seminar I was doing in Louisiana some time back. And in that seminar, she reported that she had so much anxiety that she was unable to work. Well, this influenced me. I wanted to work with her. She came up, sat with me. Turned out that the way that she created her anxiety was that she saw in her mind's eye a particular image that kept making her worried, making her upset. It upset her so much she was unable to go to work. And so I helped her to relieve that. I found out what she was seeing in her mind's eye. In fact, what she was seeing was an interesting symbol. It looked like a large black ape with kind of like it was melting, dripping. And what we did was a particular process called the visual swish process. We resolved that anxiety in a few minutes. It was exciting to do it. She was very happy about it, and we walked away from that particular meeting with a sense of resolution. Now, about 6 weeks later, I saw her again. She came back to another seminar in Louisiana. She came in reporting that she had been, for some time, for weeks, practically flying. It was almost as though she had been reborn. She'd been feeling much, much more comfortable, happy with herself. Then she spoke to me and said, after a while, she started to go into a depression. She didn't have the anxiety at all anymore. That was resolved. The image of the dark ape, the black ape that seemed to be melting, was completely and totally resolved. Didn't affect her anymore. However, now she went into a depression. I asked her about that. What she said was that she'd had a change in her medication. She'd be taking a certain kind of medication. I think it was for thyroid medication. And that there had been, the medical people had altered that medication. And as a consequence of that, or perhaps as a consequence of that, she went into what she called a depression, felt sad, felt uncomfortable, lacked motivation, which was affecting her work. So naturally I said, well, let's take a look at that. Let's work with this. She wanted to work with it, and we re-examined the work we had done 6 weeks earlier. And sure enough, the anxiety was done. But now she was involved in a depression, and that depression was caused by what she was saying to herself. We spoke for a while, and I helped her to discover what she was saying to herself. And what it was I hate myself. She kept saying to herself over and over again, I hate myself. We worked with that particular sentence, and in a short time, the sentence no longer bothered her at all. Now what I'd like to do is tell you a little bit more about how it was possible to resolve anxiety and depression in such a short time. We did that in short order, and I'd like to give you some background. First thing I'd like to say is that in the Destination Method, we work with 25 convictions. We are convinced about how the mind works. We're also convinced about our own nature as human beings. The first conviction that we have in the 25 convictions is people are beings, not actions, nor things, nor systems of things. The second one is that people are innocent, incomparably good. After that, we start talking about how people create their own emotional experience through the way that they think. People are like map makers. We make maps out of reality, and then we respond to the map that we make emotionally. And I want to give you more information about that with regard to anxiety and depression. Judy created in her mind an image that created emotional reaction. And that emotional reaction was one she didn't want. So it was my job to find out what that particular mental structure was and then change it. That's exactly what we did. We use our convictions to know that there isn't another way to create these emotions, except with the possibility of genetics and chemicals. So if there's genetics are involved in the creation of anxiety, or chemicals are involved in the creation of anxiety or depression, well, then naturally the person would probably want to go to a medical doctor, a psychiatrist, and deal with it at that level. When it's created by maps or representations of reality, what we do is we work directly with the thought, and we want to talk about that. We believe in the destination method that thoughts are created out of pictures, sounds, feelings, tastes, and smells. That is the nature of thought. They're not made out of anything else. Internal images, internal sounds, internal feelings, tastes, smells, these are thoughts, and thoughts create our emotional life. This conviction allows us to zero in on exactly what it is that a person might be doing to create anxiety, depression, trauma, grief, shock, internal conflict. In fact, any number of a host of emotional issues and difficulties that human beings have. One of the things that we hold very dear in the work that we do with the destination method is we understand that there's a difference between compassion and technology. On the one hand, we understand that compassion is necessary for the resolution of unnecessary suffering. On the other hand, we understand that technology is. We think about the heart and the sword. We think about compassion as represented by the symbol of a heart. The heart represents compassion, understanding, love, kindness, mercy, forgiveness. And what we say is we need the heart, insight, in order to assist someone in resolving unnecessary human suffering. On the other hand, we need the sword, which is technology, step-by-step procedures to resolve whatever it is that the person wants to resolve. In the destination method, we're like taxi drivers. We help people get from where they are to where they want to go by asking them 3 golden questions. What do you want? How will you know when you have it? What stops you from having it? When we find out what it is that they want, we then can use a sword, a particular cognitive method, to resolve their suffering. But what happens if we only have sword? If we only have the sword, only technology, only methodology, then pretty much we can get anything we want done. The sword will allow us to get most anything done. The problem is, getting things done with just the sword means that in the end, our results are meaningless and empty. We need meaning for our lives to make sense to us. So that means we need the heart. Well, if we only have the heart, no sword at all. If we have the heart of compassion, we have heart of compassion and understanding and love. If we're really kind with people, that's wonderful. But if somebody has a broken leg and you love them a lot, it won't resolve their broken leg. It won't fix their broken leg. You need somebody with the technology to know how to set the broken leg. We need love and compassion, as well as technology to help people. And what we did in the destination method is integrated the heart and the sword. We brought them together and had a marriage of compassion and technology, which allowed us to open up to the destination method. This is a combination of them. We utilize not only technology, but also compassion, understanding. We have a spiritual perspective in the destination method, which I'll get into very soon. So knowing this, we also must address necessary and unnecessary suffering. Most suffering today is at least most of it's becoming unnecessary. We've had a lot more necessary suffering in the past. Necessary suffering is that suffering which we have no technology to resolve. We don't know its positive intention. We don't know the value of the suffering, and we don't know how to save it. We don't know how to resolve it. Well, when we have unnecessary suffering, 1, we know exactly how to resolve it, and 2, we find out its gift. So today, we have a lot more unnecessary suffering than we had before. That means things like anxiety, shock, trauma, grief, internal conflict, belief changes. All these things can be resolved, if we want to, with the technology that we have. So therefore, these things are unnecessary human suffering. In the destination method, we work to resolve unnecessary human suffering. In a larger perspective, we have what's called the creative order. The creative order is as we have here. There are 7 levels to the creative order, from results to emotions to thoughts to beliefs to identity to soul and to spirit. The creative order is something that I created some years ago. The creative order explains or allows us to have a schema, allows us to have a pattern, a structure, to know the way in which we can work and how we do our work. Pretty much everyone would agree that when we're working with somebody to resolve their anxiety or their depression, that they have certain unwanted results. They want to change the unwanted results. And if we go right to the results, like let's say the person's unwanted result is that they're unemployed. We say, well, let's go to them and put them in employment. That doesn't seem to resolve the anxiety and depression that's stopping them from going to work. So we say, well, maybe there's a higher level, a different level of reality, a different causation that produces the result. And we would say that it's the level of emotions and actions. A person takes a certain action. They stay in bed all day. By staying in bed all day, that action produces the result that they're unemployed. And they have emotional difficulties as well. They feel depressed or they feel anxious. The emotions and the actions are pretty much at the same level. They happen almost simultaneously. Some would say simultaneously. Well, the question that we ask is, how is it possible that we have emotions and actions that produce an unwanted result? Our answer is that it's the way that people think. What we say to ourselves in our mind's ear and see in our mind's eye and feel in our body and taste and smell, these thoughts create our emotional reactions and create the actions that we take, which produce results. And so we say, well, one of the best things we can do is help a person change their thoughts. Let's remember, thoughts are made of pictures, sounds, feelings, tastes, and smells. Let's find out what the individual is in fact saying to themselves in their mind's ear. A repeated uncomfortable sentence that produces depression? Or what are they seeing in their mind's eye that over and over again produces the anxiety that's almost crippling to them, or sometimes in fact is crippling to them? Well, what we could do is we can find out those thoughts by asking them questions to reveal their thoughts. We're aware that the client typically doesn't know what kind of thinking they're going through. They have to be asked. So we ask them questions. What are you saying to yourself? What are you seeing in your mind's eye? Judy was seeing something in her mind's eye that produced anxiety. She was hearing something in her mind's ear that produced depression. We changed right here at the level of thought. By changing those thoughts directly, not through philosophy, but directly changed those thoughts. Those thoughts changed the emotions and her actions, and she went back to work. She felt better. And she went back to work and did a much better job, no longer having anxiety or depression. Now, notice that thoughts, it's very interesting, thoughts are not something that anybody can photograph. We can't photograph a thought or weigh a thought. We can't measure a thought. We can measure, for example, brain waves. We can measure synaptical structures in the brain, but those are electrical things we're measuring. We're not measuring the thought itself. The thought itself, the image that she had in her mind's eye, for example, a large black ape that was dripping with some sort of yucky stuff, we can't see that. She sees it. I don't see it. And so it's not measurable. And so it's in the realm of psychology. Those things, the psyche, the mind, as opposed to in the realm of chemistry, physics, biology. In the realm of chemistry, physics, and biology, where those are things that can be measured. We can measure the chemistry in her body. We can measure the physics in terms of how far away she is from the bed or from work. We can measure many things when it's at the level of emotions and actions, particularly actions. We can photograph her. We can videotape her in her activities and videotape the results. We cannot videotape thinking. We can videotape a person, and we don't know whether they're thinking or not because we can't videotape the thought. Well, what we have is thoughts which are immeasurable and invisible and immaterial are creating, this is why it's called the creative order, the activities that produce the results. If we just deal with the actions, we take her and put her at work and don't change her thoughts, we physically force her to be at work. This will not change the result of the depression. She's just physically doing something different. What we need is to change her thoughts, which we did in a very short time with those particular methods that we used. Now, let's say that, in fact, it didn't work. What would we do? We'd have to examine the tools that we used. Did we use the appropriate tool with the appropriate person? Did we do it properly? We'd have to find out if the person understood what we were asking for. Once all those things were covered and many more, we might discover that she had a belief. It's possible for a person to have a belief, and the belief would hold the thought in place and not be changed by changing the thought directly. So we'd have to work at the level of beliefs. Well, what are beliefs? In the destination method, we're really convinced about the definitions of thinking and the definition of belief. If you go to a university, any university in the country or throughout the world, you'll find out that there's massive disagreement about what thinking is throughout psychology departments throughout the world. Interesting enough, there's very little disagreement in physics departments, in chemistry departments. People don't disagree about how fast something falls, the velocity of something falling from an airplane at 32 feet per second. People don't disagree about that. That's like a law. People generally don't disagree that there are 206 bones in the human body. So if we go into a medical department, there's not a whole lot of disagreement in there. But when we get to the psychology department, which is supposed to study the mind, we say, well, what exactly are we studying? What is the mind? Some will say it's behavior. Some will say, no, it's not behavior, it's cognition. We say, well, what is cognition? What is it that people actually do when they're thinking? And there's a lot of discussion and a lot of philosophy. What we did in the destination method, we said we know exactly what thinking is because it works when we think of it this way. We have an operational definition, and we utilize this definition so that we can get results. And the results we got, as you may have noticed if you've seen the videotape on Judy, we resolved that particular issue about anxiety and depression. If you want to see it about the resolution of trauma, we have a videotape of a gentleman that spent many years in Vietnam and had his legs blown off. We resolved his trauma within one session. So there are many videotapes that show the kind of work that we do. Where that comes from are our convictions, our 25 convictions, which include the knowledge that human beings make maps of reality. The maps they make create their emotional life. That's what thinking is. Thinking is made of pictures, sounds, feelings, tastes, and smells, which create maps. Well, we can change thoughts directly. We can deal with beliefs, which are organized thoughts. Let's understand what it is. Results come from emotions and actions, and thoughts create them. So if you look at thoughts, we say, well, what are thoughts? Thoughts are made of pictures, sounds, feelings, tastes, and smells. And when thoughts are organized, they are beliefs. Organized thoughts end up with a belief. And this belief then controls the kinds of thoughts a person can have. If a person believes that they're incapable of learning mathematics, if they're absolutely convinced of that, they believe, say, I'm stupid about math, they simply won't go to a library. You won't watch them take an activity that contradicts that belief, nor will they think it. They won't think, it's time for me to go to the library and get a book on math, because they believe that they are incapable with mathematics. They will remain away from, they'll have certain behaviors that we can videotape them doing pretty much anything but going into the library and buying a book or renting a book or getting a book on mathematics. So beliefs are organized thoughts, and beliefs determine the kinds of thoughts that we can have. Of course, we get our beliefs from our environment, from our early childhood, from advertising on television. We get our beliefs from many, many different places, and we need to be aware of what our beliefs are. At a higher level, beyond beliefs, is the level of identity. And identity is made of organized beliefs. It is about emotion, what a person feels and wants and thinks. Who I am is what I feel, want, and think. And so you can determine how to hurt my feelings or foster my feelings. You can support me and love me when I reveal to you what I feel, want, and think. If I hide from you what I feel, want, and think, you can't find me, the psychological identity. Well, notice, down here at the results area, we have measurable effects of actions. We can videotape them. Actions themselves, we can videotape them. But then we enter into the realm of the immaterial. Thoughts, beliefs, and identity all fall in the realm of psychology. All are not videotapable. All are immeasurable. Beyond this level, things become quite fuzzy. In our work, we work at the level of psychology and the body. We do body coaching. We work with the level of the mind through some of our background in neurolinguistic programming. We have a vast background in different kinds of psychological intervention technologies. We're really happy about that. We also work at the level of soul and spirit. But let's notice, there is not that much argument in universities that thoughts, beliefs, and identity actually exist. People will say, in any psychology department, yes, thoughts, beliefs, and identity do exist. There are lots and lots of books written about them and studies done about thoughts, beliefs, and identity, and emotions, even though those are not photographable or measurable directly, that is. Well, when we get to the level of soul and spirit, we move past the realm of what people can measure, and we also move past where a lot of people are willing to accept. But nonetheless, we can say that soul is at a level higher than identity. It would be called, and as it says here, the individualized spirit. And this would be studied at a university through theology. If we were to study at a university these different topics, down here at Results, we would study results through things like chemistry and through biology and so on. Same thing in Actions. We would study chemistry, physics, biology, and psychology. When we study thoughts, we're in the realm of psychology. We study beliefs, we're in the realm of psychology, identity in the realm of psychology. But anybody who's really going to study psychology should also have studied biology and chemistry. If we have chemistry and physics are the foundation of biology, which is the foundation of psychology. Well, if we go into a university, a very large, effective university, we'll find out that higher up we go past psychology into what is oftentimes called the queen of the sciences, which is theology. In theology, we have the study of God, is what theology means, the study of theos. Well, this could be discussed in very deep ways. What is soul? If you look on the internet and you look up the word soul and Google soul, you're going to find pages and pages and pages, thousands of definitions, descriptions, and understanding of soul. Soul. It is something that people have a lot of difficulty with in terms of actually defining. But nonetheless, we go past that to soul, and how does soul influence identity? And then beyond soul, we have the level of spirit, which we have here defined as universal mind, the infinite, that which has no beginning, has no end. If this were studied, this would be studied, typically that's studied outside of university walls in something called mysticism. Once we start dealing with issues of the infinite, that which has no beginning and has no end, then things become quite fuzzy for most people, because that which has no beginning, has no end, and yet exists nonetheless would be called omnipresent. And so wherever you are, it is. And we start moving in the realm of mysticism, which is beyond the scope of what most people are interested in. But nonetheless, we have the 7 levels of the creative order. We could say that these higher levels create the lower levels. What we think about when we're working in the destination method, we say, well, yes, we're quite comfortable talking about and working with clients who want to work at the level of spirit, of God, of capital L love, of the infinite, and also soul. And we also are able to and happy to work with people who want to work only at the level of psychology or the level of the mind, the human mind. So identity, beliefs, thoughts, emotions, actions, and results. By having the 7 levels of the creative order, we have backing us up an understanding of where people are when they're functioning and where to intervene and the kind of interventions that we can use. We use a multitude of tools to assist people in resolving their thoughts. In our case, when we work with, for example, anxiety and depression, we use things like the visual swish and the auditory swish. When I worked with Judy, I did a combination of the visual auditory swish to resolve her depression, completely changing her life in a very short time. In cognitive behavioral therapy, which is an excellent psychotherapy, there's usually an understanding that it takes about 16 sessions to work with clients, and on the average, about 50% of the people get better, and about 50% of the people don't. When we work with people with anxiety and depression using the destination method, we help them to resolve their unnecessary suffering by changing their thoughts. That gets done certainly within 1 to 3 sessions. Perhaps it might take a little bit longer, but certainly not much longer than that. But 1 to 3 sessions is the way that I think about it when people come to me. And I let them know, if I can understand, if I can discover what it is that the person's doing internally that's creating their particular form of anxiety or depression, then I let them know right away we can do it. But we not only work with anxiety and depression, but shocking images. You can imagine. Shocking images happen when somebody sees something like an accident or a murder. They see something that happens, they find a dead body. Or maybe they have a memory of a time in their life when they saw a relative in a casket. A shocking image. This is not producing grief. It produces shock, a very uncomfortable reaction to what they're looking at in their mind's eye. We resolve that issue, and they no longer react with that emotional feeling. Many people will mistake shock for grief. Actually, they're not grieving at all. They just have a shocking image of somebody who's in a casket. Grief is entirely different. Grief is when a person is seeing what it is that they love, but they see it in such a way in their mind's eye that they can't have it, and they feel very badly about that. Well, we work with shocking images, traumatic memories. We work with conflict, solving conflicts. We work with solving depression and anxiety. We also work with grief. We work with so many things in the Destination Method, and I'm very happy about it. I hope that this has been instructive for you. And if you'd like more information, all you have to do is get in touch with us. You can look on the website, which is www.teloscenter.com, or you can call us personally. You can call my wife, the Reverend Dr. Luzette McDonald, or myself, Dr. Robert McDonald, at 714-577-5717 at any time. Thanks very much for your attention.